Okay, welcome everybody to the June 17th Administrative Services Committee meeting. Our first order of business is approval of the May 13th minutes.
Make a motion to approve.
I'll second that.
Motion Susan, second by Lisa. All in favor, say aye.
Aye.
Opposed? Carried. Thank you. Privilege of the floor. Is there anybody here to speak to us on the privilege of the floor? Seeing none, we'll close the privilege of the floor. That brings us to our first item, local law intro 1424, a local law amending local law 1322, providing for a management salary plan for county officers and employees. Administrative Director, North Chautauqua County Water and Sewer Districts for the Legislative Department.
Thank you, Mr. Chairman. Pierre Shagnon, Chairman of the Legislature. A little bit of a long story about this local law, and since three of you have already heard the story, please bear with me. But we have a situation where we have 4 water and sewer districts in the North County, and these are all enterprise funds, and they are all administered by the administrative head is a board of directors. And each of them is in a little bit of a different situation. But over time, we have come to a situation where the North County Water District does not have an administrative director or an executive director. They have a board of directors. And Kathy Tampio, who works for the legislature, has been providing some administrative support for that water district. And we have the Portland Pomfret Dunkirk Sewer District, that they do not have an executive director or an administrative director, but they contract with the North Chautauqua Lake Sewer District for the services of their executive director to provide those administrative services. And then we also have an industrial water district and an industrial sewer district who neither of which have an executive director or administrative director. Their board chairman just tries to borrow and beg assistance wherever he can get it to get the job done. So we find ourselves now with Kathy Tampio wanting to retire. And we also are facing a situation where the North Chautauqua Lake Sewer District is expanding, and they want their executive director back full-time. They don't want to continue to contract with the Portland Pomfret Dunkirk Sewer District. So Kathy Tampio and I got our heads together many times over this, and how can you hire a part-time administrative director for these small districts that they don't need a lot of support, but they need good support? So we came up with a concept, which you now have in front of you, of creating a position for an administrative director who would be shared by those 4 districts. So they would be the administrative director of the North Chautauqua County Water District, of the North Chautauqua County Industrial Water District, the North Chautauqua County Industrial Sewer District, and the Portland Pomfret Dunkirk Sewer District. That's enough responsibility to keep a full-time position, a full-time person, quite busy. So in pursuing this, we've spoken to all 4 of the districts, the administrative boards, and basically they're very supportive of this. Some of them are thrilled to have the additional support, and some of them are a little concerned about what this is going to cost them over and above what they have been paying. For example, Kathy Tampio, what we charge the North County Water District for her services is very inexpensive, almost painfully so. But the responsibilities that are laid on those administrative boards, and in particular on their chairperson, is substantial. And so those board chairpersons are delighted to have some administrative support. some professional, full-time administrative support. So that's where we're at. We're hopeful that we can get this position created and filled in time for Kathy Tampio to retire at the end of the year. That would enable Matt Olbeck, the Executive Director of the North Chautauqua Lake Sewer District, to go back full-time to that district for the projects that they are just initiating. So that's what we have in front of you today. I'll be happy to answer any questions. Susan?
Thank you. I'm wondering, you said the water districts, sewer districts are wondering how much that's gonna cost them?
Yes.
And so how much is that gonna cost them? The amount, do they pay in full, or how does it work?
Good question, thank you. And I should start by explaining that these 4 districts are all enterprise funds, which means that no county tax revenue goes to support them. They're strictly supported by their user fees. So those administrative boards are very concerned about keeping their user fees as low as possible. That's the background to it. The short answer to answer your question is we haven't figured that out yet, because until this position is created, we didn't know how much the salary range was going to be. We've done some preliminary work in terms of how much time is needed for each of the 4 districts, but we have not created a budget for each of the districts yet. We want to get that in place before the 2025 budget goes in place, obviously.
Yeah.
So we're pressing a little bit on this, but I don't want to get over our skis on making assertions as to what it's going to cost until we can really do a full job of assessing that.
And that will come in front of the legislature again, then?
That will go to the administrative boards. The administrative boards are the administrative heads of the district, and so what we will see as a legislature will be their 2025 budget, which will include the costs for each of those districts for this position. So in reviewing their 2025 budgets in the detail that we do, we would get an explanation as to what has changed for those costs.
Okay, thank you.
Thank you.
Anything else?
Well, I think it's a great plan, really.
Thank you.
Question, comment. My assumption is then what we're paying Kathy to help administrate that will go away.
That will go away.
Okay.
And this position will report to the chairman of the legislature.
So there is some savings
To
by
offset,
not
yeah.
needing her to,
Yes. The North County Water District is currently paying for Kathy's services, so those funds will go into this.
Right.
The Portland Pomfret Dunkirk Sewer District is currently paying the North Chautauqua Lake Sewer District. Those funds will go into this.
Right.
So
there's a little offset.
there's some offset to it,
Yeah,
yes,
okay.
yes.
Is this part of the plan, kind of the plan from the controller's initial report? Is this part of that, or?
I went out on a limb a little bit at the last meeting explaining this, Susan, and that's a very good question, that the state controller audit of the North Chautauqua County Water District had some concerns and made some serious suggestions for changes. This position will have the responsibility of fully implementing those as well as managing those. The actions that we have put in place to address those recommendations have put a significant increased burden on that board of directors, and particularly their chairperson, as well as Kathy Tampio. So this is certainly an element, a piece of the puzzle, why this position is needed. But also, as I pointed out earlier, is that the chairpersons of these 4 boards are all volunteers. They don't get paid. So when we add more responsibilities on the board of directors for the North County Water District, we're putting it on volunteers. And they need help. That chairperson, that chairman needs help. And so he's absolutely delighted that we're gonna have a full-time person that will be helping the districts.
And for what it's worth, I asked that earlier, I had a concern, I guess I still have it, of the individuals in these districts, what that's gonna add to their bill.
Burden, yeah.
But I
or
have
their bill.
confidence that
Yeah,
it'll be,
for sure.
it's probably be a user base, so it should be fairly
Spread out,
distributed,
yeah.
or whatever, yeah. Any other questions, comments, concerns on the local law? If not, thank you, Pierre.
You're welcome.
Okay, proposed resolution, amend the 2023 budget for year-end reconciliation, various departments. This is just extra information?
Yes,
Okay.
to help me explain. Kitty Crow, Director of Finance. I did lay on your desk a handout that kind of color codes all the various offsets in this resolution, because as the title states, it is some miscellaneous changes for various departments. So these really should be the final adjustments for '23. You know, a few entries took a little longer to get in, so these changes reflect a variety of things, including final adjustments for our workers' comp surcharge, and that's in majority of them in the .8 accounts. So I've color-coded, and I'll walk through all of them. The ones that are not color-coded means simply that the increase in expense it has a direct offset by a decrease in expense in the same department. So I'm going to start with the highlighted ones, and then if you have any questions on the other ones, I can go back. So the top one there, the Unified Courts Conflict Administration, $85,946. That is offset down at the bottom by fund balance. So a lot of the assigned counsel invoices do kind of keep trickling in after the end of the year. And to the extent that, you know, the books are still open, we'll book them back to the appropriate year. The next section, those three that are shaded kind of in a peach color, are carts expenditures that were in excess of the budget. Those are all offset by revenues in the department, so some departmental income as well as state aid down below in the increased revenue section. The next one, the blue Social Services Administration, so that is that budget, account Department 6010, didn't have any other offsets except for in the 6102, which was the medical assistance. You may or may not remember that we did write off it on an expense that we had accrued for several years. It might have been as many as 10 years, and Todd was cleaning stuff up, and he said, it doesn't appear that this expense is going to be incurred, so he reverse that accrual. So that freed up, that was basically a surplus in the 2023 budget. So we were able to use that to offset this additional expense. The total surplus for that reverse of the accrual was a few $100,000. Going back down to the kind of light blue color there, the $888,501. For interfund transfers. So this was some additional cleanup that we needed to do for some of the ARPA projects. As the expenses are incurred for the ARPA projects, if those expenses are incurred in the D or DM fund or any of the sewers districts or the, you know, any other fund but the general fund, we have to we receive the ARPA revenue in the general fund. So when it's used in another fund, we essentially, in accounting, terms, we have to transfer that revenue over to those other funds. So, that 888,000 was, the transfers over to those other funds. And then you can see down below, under increased revenue, we're increasing the federal aid in those, accounts. And then, for those transfers. Additionally, down in the bottom there where it says increased use of fund balance, there was about $14,000 that's part of that 888,000 that was related to year-end 2022, where there was a resolution to adjust the year-end accounts in 2022, but the actual wasn't actually recorded. It was kind of during Todd's medical absence, so it was just something that was overlooked. But essentially, those funds went to fund balance, so we have to bring them back into the 2023 budget to offset that. So that's why it's really a use of fund balance. But the surplus would have gone to fund balance, and so we're just recognizing it in 2023. The M fund had a slight adjustment there of $1,700, and that is offset by revenue down below. One other item I will call out that's not expense related, but it has to do with the accounting treatment of the opioid settlement funds. And those are the two under decreased revenues and fund balance. It's the like the light lavender color highlighting. So the way we had budgeted those funds isn't really how we have to account for them, you know, as far as the way the comptroller tells us we have to. So the settlement funds are recognized as revenue it's like under department, miscellaneous department. We had budgeted them under the health department revenue account. So really the accounting of it is, it's received in the finance department. It is a surplus, that amount goes into our restricted fund balance at the end of the year, and then we pull it back out of restricted fund balance to offset the expenses that we had that year. So it's an accounting treatment of the fund. So we probably have to make some amendments for this year's budget related to how that's treated, but it doesn't change the bottom line. It just is how we have to recognize the revenue in which account. And then, like I said, all the other ones were, you know, an increase in expense and then a decrease in expense in the same department.
Thank you for the color. That helps me.
I know it's a lot of explanation, but I mean, I hope that it was okay to kind of group them in one resolution rather than doing a separate resolution for each department
So this
represented.
takes care, so we're 2023's in the books?
Yeah. As far as I know. But.
Do we have any money still in the sales tax? Do we still have extra money?
Did we have a surplus in the 2023 budget?
We did, yes?
Yes, yes.
Do
I
we
did.
still have money available from that? I mean, is there still
Well,
an
the
existing
net,
surplus?
the net surplus of everything for the 2023 is an adjustment to fund balance.
Okay.
So it doesn't stay in the sales
it's
tax.
not separated out.
It just becomes part of fund
Fund
balance.
balance, okay. After 2023, okay, got it, never mind. I'm good.
I have a question.
Susan?
So, just in terms of the 888,000, you're transferring ARPA money from one fund to another federal fund, is that correct?
Yeah, so we received the revenue, so we're showing that we receive the ARPA revenue, and then the expense line transfer to other funds is the expense transferring it to the other funds. So we recognize the revenue in the general fund, and then we have an interfund transfer to the other funds.
And that's gonna go towards, or already
For
allocated?
Yes, so those are, so we only draw down the ARPA, we have the ARPA funds, when we receive them, we put them in an investment earning account. And then every month, as we're paying invoices, Todd looks at the total invoices for the month, and then we recognize the revenue that month. So this was just all the final, well, I should say, that 888,000 wasn't just 1 month's worth, but got booked there, and so we have to book the offset of recognizing the revenue as well.
So it's partly because I remember hearing earlier that some of what you did with investing the money actually created more money? Is that kind of?
Yeah, because we put it in an account where it could earn more interest than if we just left it in our regular bank account.
And so is this 888,000?
That's independent of this amount. This amount just represents the rest of the transfers that we had booked. We had done some other adjustments to the interfund transfer in previous year-end resolutions, and this was the final amount of interfund transfers that were in excess of what the budget was, so we have to show that increase the revenue by that same amount.
Okay. Oops. Then the other thing is, what is our unassigned fund balance then, if you take into account the?
I should know off the top of my head, but I just finished up the, updating the projections recently with all of the 2023 year end. So after these adjustments are posted, I'll be able to have a more final update, of those figures, and we'll share a, update on the 5-year projections, which includes where we are in our, fund balance position.
Okay. Thank you.
Anything else? All in favor, say aye.
Aye.
Opposed? Carried. Thanks, Kitty. All right. That wraps up our long list of resolutions and brings us to discussion. Discussion is various updates with the Health Department and New York State level mandated services. Lacey Wilson, Public Health Director.
Thank you. Lisa.
Thanks.
Hello, everybody. Thank you for having me tonight. I appreciate this time in front of
Just
you.
state your name
Lacey Wilson, Public Health Director, here on behalf of the Public Health Department. This is a great opportunity to be with you and in front of you, really to talk about kind of some of the updates and things that are coming down the pike. But just a great chance again for us to reiterate as the Health Department, we are a standalone agency now for the first time in several years. To say that we really consider you all a partner in our communities. We realize how vital the work that you do in communicating with your constituents is to the work that we do as an apolitical agency, of course, in the county and really at the state level as well. I had been talking with a few legislators about a month ago, just really kind of explaining who the Public Health Department is now that we are standalone. And they had said, this is actually wonderful information, and this might be great to just get around to the different committees to chat about, especially with some new legislators on the block. So you may hear this a couple times if you're on some of the other committees, so I apologize for the redundant information. And I will keep this brief and kind of high level and quick. And then, of course, if you have information that you'd like to request from me, I'd be happy to do that or answer specific questions. And I would love for this to be an ongoing dialogue. You're welcome to reach out to me at any point, answer questions, and help get good information out to our community about who the health department is. So I think we all know that COVID-19, did a number on the health department in a number of ways. And so I think the public has kind of developed a very specific perception of who we are and what we do. And I myself and Dr. Falk as well, we just feel really strongly about getting the right information out as to who we are and being a support to our community. So I will take you through kind of a high-level introduction here, and of course, as we're headed into the early stages of budget season, and just kind of questions that we know will roll down the pike there. I thought this was great timing. So really, I think a major thing that we can work on in the community and that we're going to be working on as the Public Health Department is really accentuating that we are a policy, systems, and environmental model agency. So I think, we'll talk a little bit more in a couple slides from now in the presentation that historically I think people really view us as a medical model agency where we provide and deliver services, which we do, portions of that. But over time, really, we've been positioned and we see the need more so at the population health level to have experts leading and supporting policy development with groups and officials like you all in partnership with you. This is a good time to have this discussion too, because the health department has been through basically 5 major transitions over the last handful of years. So those of you who have a history here would know that, it was pretty recently Health and Human Services together. Social Services is an agency, in and of itself. They have their own funding structures, their own mandated services and things to provide. There is a lot of crossover there, and in some counties, those departments are merged. In some counties, mental hygiene is merged with health and things like that. But in Chautauqua County now, we are standalone in that right. There have been different changes in leadership, of course. COVID-19, also being kind of one of those major transitions in the service delivery of what we provide in the community. And then we also are working really closely with our partners in HR and finance, and a number of the people here who I owe an indebted amount of thanks to for their help in really bolstering us and helping us set the foundation of who the health department is now as a standalone agency. We're trying to really build up a strong framework for moving forward. There is a number of significant progress that has been made, and again, one of those things that I want to highlight in regards to who we are as policy and systems environmental change. We get a lot of questions, and I know you all do too, in terms of like, well, why are you all in the housing space, and why are you talking about lead abatement in homes and things like that? Because that's not what people think of when they think of health and they think medical. So there are some programs coming down from the state within the next handful of months that are definitely policy level mandated services. One in particular, the lead rental registry, which is meant to improve the housing in certain what the state has deemed vulnerable zip code areas, to improve the housing and reduce the exposure to lead for our children, and of course then prevent all of the health implications that come along with the exposure to lead. So again, you can see that down the line, that policy works to prevent, promote, and protect, which is really the central mission of the health department. We've been working on building strong relationships with our community-based organizations, and you'll see in a slide why that is so important. And there has been some really great recognition at the state and federal levels for the necessity of a strong and healthy local public health infrastructure. There has been a recent infusion of some sizable funds from the federal government down through the states that are meant to come to local health departments to ensure that we are whole and that we really are strong in our foundation and our organization. So we're working on building those funds out in a way that really is productive for our community. As part of that endeavor from the state and federal levels, there is a fellowship program that we've advocated for, and we have been able to secure 4 fellow spots alone for Chautauqua County. which will help not only retain and grow local people in the public health arena, but it is funded completely and solely outside of any county funds and local share. So we're really excited about that endeavor and bringing some really great talent here to the county. And then, of course, I've been doing a lot of work and making some significant progress at the state level and really kind of advocating for the unique landscape of who Chautauqua County is. So when you look from a public health perspective at all of the different counties in the state, you can break them down pretty simply to rural counties and more urban counties. And in Chautauqua County, we have a little bit of both. So our health department and the experts within our health department are tasked with understanding two vastly different approaches, an urban approach and a rural approach. And there's not too many other counties that really have to maneuver all of that work in the way that we do. So that is kudos to the team and the staff at the health department who do that really incredibly and pretty seamlessly. So that's something that we've been talking a lot about at the state, and so they have been responsive, again, in the fact that we were able to secure 4 fellows speaks a bit to that, their understanding. Just a high-level kind of overview of the structure of the health department. So really, in a lot of ways, we are governed, at least in terms of the lump sum of state aid money that we get. So for those of you who are familiar with the state aid process, we get a base grant amount, an award of a pot of money that comes each year, but of course that is with the understanding that then we provide the eligible services that the state requires us to provide. And then above that, once we max out that original base amount, they reimburse us 36% of that cost to provide those services. And then, of course, local share or other revenue sources are responsible for making up the additional portion of that. So that's most likely where you all, have been very familiar with this. And all of that kind of structure of that reimbursement is governed in the state public health law, Article 6. So if you've ever looked at the public health law, it's made up of dozens and dozens of articles that have everything to do with anything in health and public health. But really, Article 6 is what speaks to specifically local health department services. There's a little bit of Article 3 and Article 28 that govern our structure as a health department. But in terms of our service delivery and what you would be seeing in our budgets, that's really governed by the statutes, rules, and regulations as defined in the guidance documents through Article 6 of the state. It is something that's a love of mine. I love navigating all of that, and I had come from the state side of things, so I feel like we're at a great advantage, that I've had some really, close working knowledge of those documents there. So I'm excited to be able to bring that to the team. And how that's broken out in terms of actual service provision here at the local level is those Article 6 programs are boiled down to basically 6 service areas. And then within those 6 service areas, there's dozens and dozens of actual programs and services that we provide. There's over 50 services that your Chautauqua County Health Department provides in our community. And those are just the state mandated services. Of course, this is with the understanding that if and when we do have the capacity to, we provide additional services that are funded either primarily through grant funds or only local share or in partnership in basically contract situations with other departments utilizing their funding to provide a service that is public health like. So again, this is just the Article 6 services that I'm talking about now. So we do a lot of work through the health department. Again, this is all kind of written into public health law, and I'm happy to answer more questions about that later if you are a law junkie like that. So in just kind of wrapping up to give you a kind of a picture of, again, where I think we can really help the community kind of understand who we are, it's by no mistake that so many people in the community have this understanding that we are a medical provider. And that's because if you think back even as recently as polio or COVID-19, we are really the agency across the state that is called on to mobilize to fill that gap in service provision that a hospital may not be able to, that a doctor's office may not be able to. We are considered that safety net provider. And so those things just happen to get the, you know, news coverage and the front page story of things. And so that's what's communicated to the public, but so often are very fundamental and essential services, like everything that our environmental health division does, these lead programs that we run, the water system. So it's timely that, you know, Chairman Shagnon was talking about, you know, water and our water and sewer infrastructure. That all really oftentimes takes a back seat in the public eye to some of these more noteworthy things. But as you look over time at the history of public health, you can see, especially in areas like ours, where we are very lucky to have health systems, hospitals, major hospital networks, federally qualified health clinics. So that enables the health department to step out of those spaces, as the state and federal governments would ask us to, and utilize our resources and services in other areas where there are gaps that aren't being filled, until, you know, the time is that there's a community organization who can fill that. We then provide them technical assistance, help them to develop a sustainable framework, and then we step out of that space and again into a new gap. Really our job is to kind of be that wraparound coverage to ensure that our community has access to a full comprehensive network of public health. And there's a graphic there that kind of explains who we are. So again, we do not do all of these things. We do not do the work of, you know, the hospitals or of elected officials or of transit or mental health or nursing home work and long-term care, but we are really considered the connector sphere. So all of those things happen at the population level. And so we are really looked at to kind of be the facilitator and coordinator to ensure that all of these systems have some way of communicating and working together. And so it's really at the heart of the mission of who the Public Health Department is to bring all of these champions and stakeholders to the table to ensure that our public has access to the best care and to improve health outcomes from the broader public health population level. And then lastly, there's a couple slides there that describe more so from an academic standpoint. Those were taken from, you can't see the very small reference there, but these are taken from a public health practitioner's presentation that the CDC oftentimes references. But these slides explain, you know, how we as individuals exist within a system and environment that affects and impacts our health. And so again, that's what the health department is really tasked with doing, is not necessarily trying to solve individual level issues or diagnoses or you know, things of that nature, but more so ensuring that we have access to systems and experts that can do those things. We aren't the content expert in that sense. So those couple slides are just highlighting that. And then lastly, again, so you can see is, you know, where we are today with our kind of policy, systems, and environmental change. The big couple ones coming down the pike will be this rental registry, our ATUPA program. So those of you who aren't familiar with that, it's the Adolescent Tobacco Utilization Prevention Act. That is a prevention program that is aimed at reducing adolescent use of tobacco products. That is now expanding in a number of ways to also approach cannabis use and the use of cannabis products by adolescents in preventing the negative health outcomes and impacts that happen there. So again, this could seem very broad and too theory-based, but this was just a start of that conversation. Please come to me. I'm happy to answer questions anytime. I love to talk about public health. So if you ask me a question, you might be with me for a good 15 or 20 minutes as, I kind of, pour my heart out for it. But just very, very happy and honored to be here and be able to serve our community in this way. So thank you.
Questions? Comments? I think I can speak for everyone. We appreciate what the health department does, and this is good. Gives us a little more of a understanding You guys are like the spackling.
Yes,
You
that's a
fill
great
in
way to
all
put it.
the- yeah.
That's a great way to put it, yes. We have to be very flexible,
Yes.
yeah. Thank
All
you.
right. Well, thank you very much. Is there anything else needs to be discussed or presented for the good of the residents of Chautauqua County here at the Administrative Services Committee meeting? If not, could I have a motion to adjourn?
Motion to adjourn.
Second? All in favor, say aye.
Aye.
Opposed? We are adjourned.
I loved it, that was great. Did you make your time? I saw him today, I was like, thank you so much.
I started reading that from Michelle, and I was like, okay, and I'm going, oh, come on. You know, I feel like